Record it.
Thank you so much.
Thank you.
I was trying to figure it out forever, and I was like, I don't know.
Yeah, and it's different with like if you're on your computer or if you're on your phone, it just so
Yeah. Okay, so what should we start with? The preparation paper, or we could talk about the reading?
hmm, I don't know.
We'll talk about the reading. How did you guys like that? That was kind of shocking towards the end. I didn't think she was gonna get married.
I know, it's crazy.
Yeah. I remember when Izzy looked it up, she's like, she actually got married. And then when Will came into the picture, I was like, no way.
This is kind of mean, but it was funny hearing her describe him and then seeing pictures of him in real life. I was
Oh,
like, whoa,
look
that does
it
not
up.
check out. Love is blind. No offense to him. He's probably a really great dude, but
That was so
yeah,
funny.
yeah. It's like reading the book and then seeing the movie. Yeah, I get that. I I don't know. I was so happy though. I think that's just like a great testament, that like whatever diagnosis you do have doesn't control your life. Like
Yeah.
no one was expecting it, and then she got married. And
Yeah.
then, like what? And like I don't know, living a happy, normal part of her life. Oh,
He's, I just looked him up. And yeah, I understand what Izzy's saying. I don't know why. I was thinking of like a skater boy with like a ponytail.
I know, me too.
His last name?
Mm,
Will Butler, I think. Let me see. I think that's what his last name is. Oh no. I don't know. I just looked up Ellen's husband from The Center Cannot Hold and it popped up.
did you guys get a chance to watch the TED Talk?
I did not.
No.
Not yet.
It was pretty much the same as her book. She actually read from her book a lot, but it was really interesting to see her do that and like to hear her read like some of her episodes aloud.
Okay.
And
Yeah.
even like her husband was there. He was like in the front of the audience and she's like cracking jokes about him. And
Oh,
I just think, yeah, it's really interesting to see how like having a healthy relationship can help her so much. And that really seemed to be like what saved her throughout the whole book. Like whether it was a relationship with her friends or her therapist, they're who like got her medicated and, made her feel like she was worth something. So
yeah.
it's interesting.
That's cool. I'll have to watch it. No, I was happy for her in the end, especially because she really wanted to be in a relationship too towards the end.
Yeah.
I also think it's cool that she's still friends with David after they broke up.
So, I guess if no one's saying anything, what are your opinions on what's his name? The Kaplan guy, Dr.
Oh,
Kaplan.
I was not a fan of him. Like, I understand that he was trying to help her, but I feel like he was doing it in the wrong way. Like, he was pushing it too much when she just like he was like she did not want to take medications and he was like threatening to like leave her and stuff instead of like helping her.
No, I think you're right. For 1 second. I'm in the middle of brushing my teeth. Let me go spit real quick.
I didn't hear
So
much of
sorry, it's
that.
been a really crazy morning. But I think Kaplan was initially right in, taking a firmer approach with her. Like I think in some ways he was the push he needed, but after seeing her for so long, I think he kind of lost that separateness, that therapists need with their clients. And to him, it became like, oh, she's not doing this, so I'm gonna be mad at her, kind of he took it
Yeah.
personally. And I can see why, because he treated her for a long time, but as a professional, he shouldn't have done that. And I think that's where it lost its effectiveness. At first, it was like okay because there was like a method to his madness. He was trying to get her to see, like, I really liked how he got her to see like the separate versions of herself and how she needed to accept all of them. And he had to be harsh to do that, but I think
Yeah.
that towards the end, like, he acted like a little kid, being like, you have to, I'll stop hanging out with you if you don't stop doing this. I mean, like, she's psychotic and is coming for help. Like, that's not,
Yeah.
so I'm glad that I think that shows like the progress she was making, that she was able to accept, the change that might come from ditching him and stand up for herself. Like that, she's really cool to me for that.
Yeah, I agree. That's a good view on it. What about
Yeah,
you,
yeah.
Court?
I was gonna say I kind of share the same opinions because it was really hard for me to want to be on his side after that.
Yeah.
Um, but I do understand why tough love is probably necessary. Like my dad, he's not a psychiatrist, but he is a doctor, and he's always complaining and telling me, not like whining about it, but he's always telling me, trying to make sure I don't end up like it, where he's like, so many times I'll give patients a prescription, or I'll give them not even a prescription, just special instructions to follow. They don't follow it, and then they need something amputated,
Mm,
right? Because they don't want to listen. Um, and sometimes people will try to sue over that. They're like, "Oh, the treatment didn't work," and it's like, "You didn't even do what I said." Why is this? It's like, so I can understand why doctors, and I have no idea how many times Dr. Kaplan went through this with other patients, but I still think he shouldn't have lost his cool, especially as a like as a psychologist and not just a medical doctor. His purpose is to help her find some stability. And also complaining about, we're not making progress. I don't think that's helpful at all. Threatening to, and it's interesting because it's like, when I served a mission, the place I was serving in, um, it's, I kind of like, I understand a little bit the idea of like, I don't agree with it in this scenario, but when you like have to kind of threaten to take action a little bit if they don't keep doing it, like I'm gonna have to stop seeing you because that was very necessary in the place I served. It was very easy to find people to teach. Everybody wanted the lessons, but the majority of them weren't taking it seriously. So we would have to be upfront because for most of the time I'd beat around the bush. But eventually it got to the point where it's like, okay, and you learn how to do it in a nice way though, right? Which is why I still don't agree with Professor Kaplan. You have to be upfront from the beginning and tell them what the expectations are. It's like, we're not going to force this on you. It's all your choice. But if you don't want to do these things, then we have no reason to be here. And the way we explain it is because if we keep coming and we keep asking you to do these things, that's going to be putting unnecessary pressure on you. So we basically leave it up to it's like, I'm not deciding to leave. You're deciding to take this seriously or not.
Yeah.
And I think that's a better approach because then it's like, it's not like, oh, I don't want to be here. Like, I don't like you. Um, or like, I'm sick of this. It's more like, well, one, they know from the beginning what's expected, and two, it's like if you're not going to use this time wisely, if you're not going to do what if we're not going to accomplish the purpose of this, we don't know why we should keep doing this. So it's like we're encouraging you to do it, and if you ever decide you're ready to continue, even after you stop, we'll be right back there. We'll come back immediately if you feel like you're ready. But you got to like break it down. You got to do it from the beginning so that way it doesn't come across as like a betrayal later on. You got to do it from the first lesson and explain how things go. And then, but for Kaplan, it's like he had a 13-year relationship, I think, right? And then at the end of it, just out of nowhere, not only does he lose his temper, but it just like feels like a betrayal. So it's kind of like that's like not the way to do it. And from someone who has had to use similar methods, it makes me mad to see that he's used them in such a bad way rather than helping her make the choice for herself. It's just kind of like he's chastising her the whole time. But it still surprised me when it was him like losing his temper that got her to finally realize she needed medication. Because that one was like when she suggested the anxiety meds and he just lost it. And then from then on, that's when she decided, I'm just gonna start taking meds. I thought that was interesting because it's like I don't like his method, and I wonder if there was a better way he could have done that. Does that make sense?
Yeah.
If I can throw my hat into the ring here, I work in like a pain clinic when I'm not up at school, and we have like a similar 1, 2, 3 and you're out kind of method. And so, like, seeing how he behaved, it definitely was inappropriate. When he felt that he was that attached, as a good therapist, he should have recommended her somewhere else and told her the truth of, like, I cannot distance myself from this anymore. Because honestly, like, in that, he was being extremely unprofessional and projecting his desires onto her, which is not okay at all. But we had a little bit of a harsher method. I worked in a pain clinic, so that meant opioids. So compared to a missionary where they're like, hey, like, we don't want to put that much pressure on you, we were like, hey, you're wasting your time and overusing your medication. You have one more chance before you're out of here, right? Because it is a matter of like, legally, we can't be prescribing people these things if they're not taking it and they're not listening. And so the doctor I worked for had a very good way of like, when he noticed the behavior, because when someone comes in to get help, you don't want to immediately be sat down and be like, okay, if you mess this up, you're out of here. Like, you don't want to be told that. That's kind of why you like sign contracts and stuff, because it will be in the contract, which I'm assuming she signed when she was working with him. Um, and so when like we would notice that behavior in the patients, when the doctor decided it was finally time, he would give them like an ultimatum kind of. He would be like, okay, so either you start listening to me and you do this, or I'm just going to start prescribing you vitamin D and I'm going to give you like, and I'm going to do what I can for a month because legally I have to, and then you're not coming back to this clinic because you're wasting my time. I have like 100 people on a wait list that want to come in and see me. And so it was like a little bit meaner. And I do think, though, that that is an okay method, in my opinion. Like, if someone's wasting your time, especially when you have other people who want care, then kind of just like, boop, you got to get out of here. It's time to go somewhere else that you feel like. And there definitely could have been a better type of therapy for her if that's really, if she really didn't want to take medication. A good therapist would have been like, okay, I see that you don't want medication. Let's send you somewhere that I know that they're probably not going to be prescribing you medication. You just want to talk? Let's send you somewhere there. So that's kind of my thoughts.
Yeah. I like how you said like he should have recognized that he could no longer distance himself and then make the decision based on that.
Mhm.
Because another thing that was going through my mind is like, even though he's kind of portrayed in a bad light, and his outburst to me feels like it's a little out of nowhere or like unwarranted, but at the same time, I don't know how many times he's had to deal with this,
Mhm.
or how many times that, so maybe in his head he's thinking like I wasn't harsh enough before because it never got through to her, but now, you know, so it's like because I definitely understand you do need to be stricter, especially like in a medical sense.
Mhm.
As you know, like we said, she's a psychiatric patient. This isn't like a normal illness. This is like a problem with their mind. So I feel like I don't know, like, and it's easy to think like, oh, I would explain it or I would do it differently. But at the same time, I wasn't there for 13 years.
Right.
Maybe trying to be a bit nicer about it and seeing that not work. So I don't know, but it is interesting to think about because it's like, on the one hand, it's unprofessional, but on the other hand, one of his outbursts actually seemed to work, where 13 years of otherness, other things didn't. So it's kind of like, what's the best, like exactly what is the best method, and it's different for everyone, but yeah, I just thought that was interesting.
Yeah. I think just off of the that she left, the she probably, this is my guess, is that she sounded kind of like a broken record. It was the same thing over and over and over at like every meeting where he was like, okay, these meds will help. And then she was like, no, 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 no. Like, so I can see where he would have gotten frustrated. But at the same point, I do think that a therapist has a responsibility to like look at it and be like, okay, it's been like a year now. I'm not helping her. She needs a different kind of therapist, because I don't think like it's a matter of making her lose treatment or lose someone she trusts, but like transitioning her slowly into another therapist, I feel personally would have been the healthiest way to handle it. Because if I'm with someone for 13 years, right, and I'm trying to have them get help and it's just not working, and my method that I'm offering isn't working, then it seems logical to me that I need to send her somewhere else that they have a different method they're comfortable with. Because he worked with like prescribing medications, right? Like he was like, hey, I know what I'm doing around this, but if she needed more like person centered therapy, then like that, and that's not my wheelhouse, then slowly transition her somewhere else until she felt trusting in that person. And then I'd be like, okay, like I'm passing off, I'm passing you off to this person. Like, I think you're going to get better treatment there. At least that's kind of my thoughts.
Yeah, I agree with you. I did think it was creepy a little bit when he was like, "No, you can't go see another therapist." Where she
Mm,
like, gave him those like, "Here, this is what I want to change." I felt like that was a productive behavior, and he was like, "No, you can't." Like it's the same, like they were both like broken records, just talking back to each other. So I'm glad that she found another doctor.
yeah. Is there anything else in the reading that stood out to everyone?
Not that I can think of.
Yeah.
We could move on to preparation.
Okay, yeah, that works.
Yeah, okay.
What did you guys, what diagnosis did you think that Jessica had?
I said major depressive disorder. I don't know. I did not feel very confident in this assignment.
Neither. It was difficult. I did a depressed, like I said, she was dealing with a depressive episode, so I guess similar.
Yeah,
How long did it say she had it again?
Um, oh, I don't remember.
yeah, me either.
Um,
Because I put major depressive disorder, but I didn't really take into consideration because I don't remember seeing if it said like for 2 weeks or not.
Yeah, there
Yeah,
wasn't very much detail on any of them about the time thing, you know?
I think that's why we were so
Yeah,
confused too.
I think it is kind of abstract, so I don't think we're going to get dock points if that's not correct. And if we
yeah,
do, then we will claim.
yeah, because I just said, I just said, depression.
Yeah. And
Yeah,
Yeah,
It probably, what she was avoiding through her achievements and like burying herself in work was like finally coming up. So
yeah.
I don't know if that counts as major depression or if it's just a depression episode. I don't know. I just said depression.
did you guys think
Just roll with your
that,
boat.
oh, sorry.
You're good.
Do you guys think the questions like what evidence do you see for this diagnosis and what are symptoms of concern were kind of the same deal? Like I
Yes,
almost want to copy and paste because I'm like the symptoms
yeah.
are the evidence, you know?
little. I just kind of went more
I
into detail on the evidence section, and then I like did it straightforward on the symptoms.
That's a good idea.
Yeah, that's what I did too. I like did a tiny little paragraph to describe like what I was thinking, what I was thinking, and I just like listed literally the symptoms. So
Yeah.
I don't know.
yeah, I kind of put like a what do you call it? Like I mentioned for the evidence, I would put a list of all the things that made me think it was depression. But then
Mhm.
for the symptoms, symptoms of concern, I kind of put like the ones that felt more threatening, like, her desire to die, might not be directly suicidal yet, but it's like that seems like a concerning one.
Yeah.
Yeah.
And then even like lack of ability to work. I didn't write that down, but maybe I should. Like her, lack of motivation, that's a concerning one because it makes it harder to live her life and to do what she needs to do.
Yeah, I did that
So
also.
I kind of separated like, just
They,
the
like,
ones that she has versus the ones that might be like the biggest problem in her life right now, if that makes sense.
that's
Yeah,
smart. I accidentally did the same thing. I said increased thoughts of suicide, distancing herself, and lethargy. So,
yeah.
Yeah,
I also added in, I don't know, like this is just jumping, but I put insomnia because she was also like having trouble sleeping, but I don't know. I just said
yeah.
possibly.
no, it's true. Yeah. So, what did you guys say for the fourth question? Because this is where I was like, I don't know.
What did I say for that? I don't know. I just said like the biological perspective would offer like the SSIs or the SSNRIs, all those letters, the serotonin reuptake stuff and the norepinephrine. But for like the psychologist one, I did like he might do like interpersonal training to help her manage like her relationships and see if that would help. I don't know. I just looked through the
Yeah,
options in the textbook and I was like, maybe
Ew.
this one.
Yeah, I said something similar. I said antidepressants combined with psychedelic assisted therapy. Yeah.
yeah. I
Okay.
also did
I
something similar to
suggested
that.
the emotion focused therapy
Oh,
because that one tended to focus on like feelings of inadequacy and like it seems that her high stress job was like causing a bit of that. So it felt like it was more geared towards her situation specifically.
mm-hmm.
For antidepressants, I just picked the MOA one, the MOA inhibitor, but I don't really know the difference.
Me neither.
Yeah. No, I did like also, oh shoot, it says we're running out of time.
Oh,
I
so
did my personal email too.
if did you do your BYUI email?
No, I did a personal one because I thought
Okay.
that's what I mixed
No.
it up.
Oh, I'm sorry.
Okay.
Yeah, you mixed it up. It's okay. If you want, we can just close this one and jump right back in if that would work.
Okay. Yeah.
We got like 10 minutes left, so maybe when that's done, we can just
Okay.
start it. So, and
Okay.
I'll start the recording.
Sounds good. Okay, I'm so sorry. That's so
Don't
inconvenient.
worry
And
about it.
submit two links to the thing.
Yeah.
Yeah. So I just do a new one, just a new link, or
You just start a new meeting, it should be fine, and just send it in the
okay.
text. And then, in the future, if like you ever have to do this for
Yeah.
another class, it took me a long time to figure out, but yeah, use your school email because we get
Cool.
some perks. So
Okay.
I sure is like not paying to have an
Name
hour
is
long thing.
NG.
So
Yeah. Okay. But I also did like for it, I wasn't sure, but I was thinking like the cognitive behavioral therapy because that's like more trying to like center her thoughts and like focus on something because she was having like trouble focusing on things. So I was like, maybe that could help out as well, like just talking to a therapist about that
yeah,
on top of the other things.
I think CBT is definitely very interesting. I think even if
Yeah,
somebody like is on medications, they should probably do it in conjunction with CBT because like the goal is to be off of those at some point. And if you train your mind to
exactly.
like live with the problem, like it'll be better. So yeah,
Yeah.
I like that, Jazz.
Okay, this is such a silly question, but when you guys were reading the textbook and you read CBT, did anyone else just like, did their brain just glitch and you read CBD?
Yes.
That's,
Me
that's
too.
a hard one.
There's a
I
lot of
feel like read it.
people.
No, but to go along with that, kind of, did anybody else like, was anybody else surprised about like the ketamine that people get, the special K to treat their mental illnesses?
No, I've actually heard a lot of research about that, and I have a
Yeah.
girl, her dad works in a ketamine clinic. Like apparently this is
Oh,
a thing.
Whoa.
Yeah, so I like had heard about that a week before I read the textbook, and then I was like, oh, it's a thing. Yeah.
no,
Cool.
it surprised me because like, I mean, I got on special K when I got my wisdom teeth taken out, and I was like super high. So I'm glad that they have like clinics to manage that because like I mean, I was really happy, but it was only for like 3 hours,
Oh,
So
Yeah.
like
or
I
doses.
wonder, yeah, lower doses, like more frequent. And I mean, like I feel like that's something that could get abused pretty easy. So I'm glad that it's like monitored really
Yeah.
well.
I love that you're reading the textbook and you're like, okay, I was happy on it.
No, I talked in a southern accent at like the top of my lungs for like 3 hours. Like I'm apparently like really sensitive to drugs. My mom was worried they gave me too much and that I needed to go back in. So
It's
I
so
was like,
funny.
are people really getting this?
So I bet you have some funny videos from
Oh
that.
yeah, too many. But yeah, what was the other one that was kind of oh, the psychedelics. That was kind of interesting. Like I've heard a lot of like research done on that, like, having people eat shrooms and then do cognitive behavioral therapy. Like,
Yeah.
I don't know. It's really interesting to me and I don't know how to feel about it.
Yeah, I don't know.
So,
There are, when I was working in the pain clinic, again, I met so many people. Oh my goodness. Um,
bless you.
um, we had a lady who came in and she literally had taken like some marijuana before coming in because she got so anxious in the doctor's office. And so she was having a grand old time. She was a doctor. And he came out and he looked at me and he was like, this is the best I've ever seen her. Normally she's shaking in fear. Doctors, but like, she's high as a kite and loving it.
Yeah. Oh, that's
That's funny.
Oh, didn't they say something too, like about marijuana? Because like a lot of people, like it's medical, but like they said something about like some extra symptoms, how that can like cause more problems in the long run. I don't know. Do you guys have any thoughts on that?
I definitely can see how like it was illegal for a long time for a reason. Like I can see why that would be a concern. And I think that out of all of like the medications out there for concern, marijuana is definitely like not the first one I would have gone to because like it is literally like a pleasure drug, you get high off of it.
Yeah.
And so I don't know. I would see how there's like a weird long-term effect of like I would probably assume that like coming off of it is awful. If you're like constantly taking it, it's probably the withdrawal is one of like a really bad withdrawal compared to some other medications you could be taking, you know?
Yeah. I totally agree. Anybody else?
Uh, I don't know. I've never been high before,
It's a
so I
good
can't really.
I've been high. I'm just saying I've seen people
thing.
high.
No, it's like I haven't even got my wisdom teeth pulled. Like I haven't done anything like that, so I don't really know what it's like. But it is interesting to see how much more legalized and normalized it's become. Like there was not a dispensary before I left, but then when I came back to America, now there's a dispensary.
Yeah, everywhere.
Um,
Yeah.
yeah, so it's just kind of, I don't know.
Do
Drugs
you
are weird.
have 4 degrees in your home?
Sorry, what?
4 Degree. It's literally a marijuana shop. I live in Nebraska and they're everywhere. It's
No
crazy.
way.
Corner.
I don't know what it's called. It just said dispensary on it. Maybe it's the same one. I didn't, you know, I haven't spent a lot of time there, so I
State
wouldn't know.
marijuana.
I remember it because
Um,
I said it and I was like, that's the dumbest name ever.
Yeah.
what's it called again? What's it called again?
4 degrees. It's literally a four and a degree sign. Yep,
Dumb.
I know.
Weird.
I was like,
No,
what
I
is
have no idea.
had like all marijuana plants on their window and was like, never mind. I got it. I got the general gist.
Yep.
Yep.
It's interesting because like I agree that it could be like super hard to come off of that. And like, there's people I work with who even just like vape and it like ruins, like they have to take breaks several times throughout the work shift to go out and vape, it takes up time. And, but on the other hand, like I have people like my grandpa who have never smoked weed or anything like that, but probably could really use it because like he like broke his back and like none of like the more like I don't know, pharmacologist kind of pharmacology stuff has like really helped. And so he's just in pain all the time. So it's hard because like at what point do you like draw the line? So,
Yeah.
but
I down to like the dosaging. Because if it's enough dosaging that you get high, then it's probably too much.
Probably.
Because then it's more recreational. But then like if it's so minimal that it's just like reducing pain or it's like helping you kind of settle your anxieties or something, then I feel like if you can't feel it and you don't feel, I'm not sure if this is the right word for it, but buzzed.
Yeah.
Yeah, if you're feeling that, then it's probably too much, or you accidentally forgot and took another pill. So
Can people like build up a tolerance though? That's like I'm sorry, drugs are really interesting to me. Not in the sense that I want to go do drugs, but
I was just curious is all. Just kind of
yeah.
asking for a friend. Yeah.
any medication you take, your body builds up a tolerance, but because marijuana is like so straightforward in what it does, I think you build up a tolerance much faster than
Yeah.
like your medications.
Yeah. Oh,
I'm
we got less
not
than a minute left.
but yeah, I don't know.
Do we want to do the link again? It's gonna boot us out.
Okay.